Hi everyone, welcome to another video of NS Pharma. In today's video, we are going to study 20 important multiple choice questions. These questions are very important for the pharmacist competitive exams like government pharmacist exam, Gpat Niper Drug Inspector, and also for the PROMETRIC exams of different Gulf countries. I also included some previous year exam questions in this, so try to do all the 20 questions and comment your score below. Before going into the video, if you didn't subscribe until now my channel, kindly subscribe the channel and also press the bell button so that you will get the notification whenever I upload new videos. So let's begin. The first question is, an example of autocoid is. An example of autocoid is. Options are option A, histamine, option B, serotonin, option C, prostaglandin, option D, all of the above. Okay, an example of autocoid is histamine, serotonin, prostaglandin, option D, all of the above. The correct answer for this question is option D, all of the above. All of the above. That is histamine, serotonin, prostaglandin, all are belongs to autocoids. What are these autocoids? They are biological molecule which acts like local hormone. Okay, these are the biological molecules or biological things which acts like local hormones. Okay, what are the other examples? Right now we studied histamine, serotonin, prostaglandin. Some other examples coming under this autocoid category is angiotensin, then leukotrienes, then cytokines, etc. Okay, angiotensin, leukotrienes, then cytokines, this histamine, serotonin and prostaglandin all are coming under the autocoid category. Now we are moving to the next question, question number 2. Before that, you can join my Telegram channel by clicking the link which is given in the description box. Now we are moving to the next question, question number 2. In geriatric patients, the dose of Digitalis is reduced due to. In geriatric patient, the dose of Digitalis is reduced due to. Options are option A, nephrotoxicity, option B, liver toxicity, option C, cumulative toxicity, option D, none of the above. In geriatric patient, the dose of Digitalis is reduced due to nephrotoxicity, liver toxicity, cumulative toxicity, option D, none. Okay, the correct answer is option C, cumulative toxicity. Because of the cumulative toxicity, in case of geriatric patient, the dose of Digitalis is reduced. What is the antidote of Digitalis or Digitalis toxicity? It is Digibind or Digitalis immune fab. Okay, Digitalis immune fab, that is Digibind. That is the antidote of Digitalis toxicity. During Digitalis toxicity, we are giving potassium chloride solution. Why? Because Digitalis causes hypokalemia. Okay, the level of potassium in the serum will be lower due to the Digitalis toxicity. In that case, we should give potassium chloride solution. Okay, now we are moving to the question number 3, that is recording of transactions in journal is called. Recording of transactions in journal is called. Options are posting, option B, casting, option C, journalizing, option D, tallying. Okay, recording of transaction in journal is called posting, casting, journalizing, tallying. The correct answer for this question is journalizing. Okay, journalizing. It is called journalizing. What is posting? Posting is the transferring of the entries from the journal to the ledger. It is called posting. What is posting? Transfer of entries from journal to the ledger. That is called posting. Okay. Now we are moving to the next question, question number 4. Example of scheduled C drug. Example of scheduled C drugs. Options are penicillin injections, option B, penicillin tablet, option C, serum, option D, ibuprofen syrup. Okay, example of scheduled C drugs: penicillin injections, penicillin tablet, serum, ibuprofen syrup. The correct answer for this question is option C, serum. That is scheduled C drug. Example is serum. What are the scheduled C drugs? It contains biological products. It is the list of biological and special products. Schedule C represent it is the list of biological and special product, that is schedule C. Okay, what are the examples of the drugs which is in the schedule C? One is what we discussed here is serum. The other things are antigen, okay, vaccine for parenteral injections, insulin, etc. Okay, insulin, antigen, vaccine for parenteral injection, all are coming under, even this serum also coming under in the schedule C drug. Okay, now we are moving to the next question, question number 5. Ketorolac is used as. What is the use of ketorolac? Options are analgesic, option B antipyretic, option C anti-inflammatory agent, option D all of the above. Analgesic, antipyretic, anti-inflammatory agent, option D all of the above. Ketorolac, we know that it is coming under the class NSAID, non-steroidal anti-inflammatory drug. Okay, this is coming under the category of pyrrolopyrrole derivative. In NSAIDs are classified into different categories. Out of this, ketorolac is coming under the category pyrrolopyrrole derivative. The answer for this question, ketorolac is used as option D, all of the above. It has got analgesic activity, it has got antipyretic activity, and also it has got anti-inflammatory activity. Okay, ketorolac is used as all of the above. The option D is the correct answer. Now we are moving to the next question, question number 6. Mcqs. Mcqs is anticholinergic drug used to treat. Mcqs is an anticholinergic drug which is used to treat. Options are vertigo, option B nausea, option C vomiting, option D all of the above. What is the use of Mcqs? Vertigo, nausea, vomiting, option D all of the above. The correct answer here is option D all of the above. Mcqs can be used for the treatment of vertigo, nausea and vomiting. Mcqs here in the question itself, it was saying that it has got anticholinergic property, and also one more thing, it is a moderately active or moderately sedative antihistamine. Mcqs is a moderately sedative H1 antihistamine. Okay, Mcqs is a moderately sedative H1 antihistamine. Now we are moving to the 7th question. Question is, ascorbic acid is used in the treatment of. Ascorbic acid is used in the treatment of. Options are scurvy, option B beriberi, option C hemorrhage, option D purpurea. Okay, ascorbic acid is used in the treatment of. We have got 4 options: scurvy, beriberi, hemorrhage, purpurea. Okay, the correct answer for this question is option A, scurvy. Ascorbic acid is used for the treatment of scurvy. Ascorbic acid is also known as vitamin C. Okay, vitamin C. This maybe in the question, maybe it will come vitamin C is used in the treatment of. At that time also you have to select for scurvy. Okay, vitamin C, that is ascorbic acid. Beriberi, that's we already discussed in the previous video. That's disease which is caused due to the deficiency of vitamin B1 or thiamine. Okay, vitamin B1 deficiency causes beriberi. Okay, now we are moving to the 8th question. Steroidal diuretic is. Steroidal diuretic, that is diuretic which has got steroidal structure. Okay, which of the following diuretic has got steroidal structure? Option A furosemide, option B hydrochlorothiazide, option C spironolactone, option D ethacrynic acid. Okay, we have got 4 options: furosemide, hydrochlorothiazide, spironolactone, ethacrynic acid. Which one has got steroidal structure? The correct answer is option C, spironolactone. When you draw spironolactone, you can see there is a steroidal structure. Okay, spironolactone is the correct answer here. Now we are moving to the next question. Before that, we will study some brand names of these drugs, that is furosemide or furosemide. The brand name, famous brand name is Lasix. Okay, Lasix. What about hydrochlorothiazide? The brand name is acid drugs. Acid drugs. So hydrochlorothiazide brand name is acid drugs. And spironolactone. In case of spironolactone, the brand name is aldactone. Okay, aldactone. These are the famous brand names of this drug. Okay, now we are moving to the next question. Question number 9. The symbol for pint is. The symbol for pint is. Options are O, option B, C, option C, GTT, option D, GR. What is the correct answer here? The correct answer is option A, O. O is the symbol for the pint. What about C? What is the symbol of what it represents? C. C for gallon. Gallon. Okay, gallon. What about GTT? GTT is gutta or it's drop. Okay, GTT means drop. Okay, GR means grain. Okay, GR means grain. Now we are moving to the next question, that is question number 10. Calamine powder is a mixture of zinc oxide and. Calamine powder is a mixture of zinc oxide and. Options are option A, ferric oxide, option B, aluminium oxide, option C, caramel, option D, amaranth. Calamine powder is a mixture of zinc oxide and. The correct answer is option A, ferric oxide. Ferric oxide is the correct answer here. Now we are moving to the next question, question number 11. All are killed vaccines. All are killed vaccines except. All are killed vaccines except. Options are rabies, option B, BCG, option C, pertussis, option D, tetanus toxoid. Which of the following is not a killed vaccine, or all are killed vaccines except? Which of the following is the live vaccine? Okay, the correct answer is option B, BCG. This topic we already covered in the previous video. Anyway, I will repeat once more. Vaccines are categorized into two types. One is killed vaccine, another one is live vaccine. Okay, killed vaccine and live vaccine. Killed vaccine is also called inactivated vaccine. Live vaccines is called attenuated vaccine. In case of killed vaccine as well as live vaccine, there are two types, that is bacterial vaccine and viral vaccine. Okay, killed bacterial vaccines examples are cholera vaccine, plague vaccine, then pertussis, that is whooping cough vaccines. For the viral killed vaccines examples are IPV. IPV means inactivated polio vaccine, that is Salk vaccine. Vaccines for the polio is two types, Salk vaccine and Sabin vaccine. Salk vaccine is IPV and Sabin vaccine is OPV or oral polio vaccine. OPV is coming under live viral vaccine. Okay, since polio is a viral disease, so live viral vaccine is OPV. Okay, now we studied killed bacterial vaccine. Now that is examples are cholera, plague and pertussis. In case of killed viral vaccine example, we studied IPV. Another examples are rabies vaccine, then hepatitis A and hepatitis B vaccines. In case of live vaccine or attenuated vaccine, bacterial vaccine example is live bacterial vaccine, example is BCG. Okay, Bacillus Calmette Gori. Okay, that is the BCG. Then viral, live viral vaccine example are OPV. Then mumps, measles, rubella. Okay, that is MMR, measles, mumps, rubella, MMR vaccine. Okay, these are the important points in case of vaccines. The last one there in the option, that is tetanus toxoid. This is not a live attenuated or killed inactivated vaccine. This is coming under the category of toxoids. Okay, toxoid, tetanus toxoid, that is called TT. Okay, now we are moving to the next question, question number 12. Muscle fibers are surrounded by a cell membrane known as. Muscle fibers are surrounded by a cell membrane. What is the name of that cell membrane? Okay, Options are plasma lemma, option B pleura, option C peritoneum, option D sarcolemma. Okay, what is the name of the cell membrane which surrounds the muscle fiber? That is the question. Correct answer is option D sarcolemma. Sarcolemma is the cell membrane of muscle fiber. That is the sarcolemma. What is plasma lemma? Plasma lemma is just the plasma membrane of a cell. Plasma membrane which bound the cell, or it is the cell membrane. Pleura include two thin layer of tissues which surrounds the lungs and which function as a cushion. Okay, which functions as a cushion for the lungs. Okay, so pleura is two thin layer of, pleura include two thin layer of tissues that protect and cushion the lungs. That is pleura. Pleura has got inner layer and outer layer. Inner layer is called visceral layer. Okay, inner layer is called visceral layer or visceral pleura. Visceral pleura is the inner layer. Outer layer is called parietal pleura. Okay, visceral pleura is there, parietal pleura is there. In case of the lungs, the just two thin layer that will protect this lungs is called pleura. Out of this two thin layer, the inner layer is visceral pleura, outer layer is parietal pleura. What is peritoneum? Peritoneum is the membrane which lines the abdominal cavity and abdominal organ. That is the membrane which lines the abdominal cavity and covers abdominal organ. That is the peritoneum. Now we are going to the next question. Question number 13. The breastbone is called. What is the name of breastbone? Options are scapula. Option A scapula. Option B sternum. Option C clavicle. Option D ribs. The breastbone is called. Correct answer is breastbone. So it is sternum. Okay, sternum. Sternum is the correct answer. Option B is the correct answer. What about beauty bone? Beauty bone is this clavicle. Okay, beauty bone is clavicle. Okay, clavicle is the beauty bone. Now we are moving to the next question. Question number 14. Keratin is a. Keratin is a. Options are hormone. Option B structural protein. Option C glutein. Option D peptone. Okay, what is keratin? Keratin is a option A hormone, structural protein, option C glutein, option D peptone. The correct answer is option B structural protein. That is the keratin. Keratin we can see in the hair, in the skin, and also in the nail. These are the major area where we can see this keratin. Keratin is a type of protein which makes up our hair, then skin, then nail. Okay. Now we are moving to the next question. Question number 15. Pyrethrum belongs to the family. Pyrethrum. That is the question is from pharmacognosy. Pyrethrum belongs to the family. Options are Umbelliferae. Option B Rosaceae. Option C Compositae. Option D Euphorbiaceae. Pyrethrum belongs to the family. The correct answer is option C Compositae. Compositae. The family of pyrethrum is Compositae. What is the pyrethrum? It is the Chrysanthemum cinerifolium. Chrysanthemum cinerifolium. It's also called, or its synonym is insect flower. Why? Because it is used as insecticide. Pyrethrum is used as insecticide. Because of that it is called insect flower, pyrethrum. Okay, Chrysanthemum cinerifolium belongs to the family Compositae. Now we are moving to the next question. Question number 16. Myristica fragrans is the botanical name of. Myristica fragrans is the botanical name of. Options are Jadamansi, option B Kurchi, option C nutmeg, option D cassia. Okay, Myristica fragrans is the botanical name of. The correct answer for this question is option C nutmeg. Nutmeg is the correct answer. Myristica fragrans is the botanical name of nutmeg. Okay. What about Jadamansi? What is the botanical name of Jadamansi? Jadamansi botanical name is Nardostachys jadamansi. Okay, Nardostachys jadamansi. Okay, that is the Jadamansi botanical name. Nardostachys jadamansi. What about Kurchi? Kurchi is Hollerina antidyscentrica. Hollerina antidyscentrica. Cassia. Cassia is Cinnamomum cassia. Cinnamomum cassia. Okay. Now we are going to the next question. Question number 17. Chemically, kaolin is. What is kaolin? The options are hydrated aluminium silicate. Option B. Hydrated magnesium silicate. Option C. Hydrated silicon dioxide. Option D. Hydrated ferrous sulfate. What is kaolin? Kaolin is also called China clay. Okay, China clay. Kaolin is China clay. What is the kaolin? Hydrated aluminium silicate, hydrated magnesium silicate, hydrated silicon dioxide, and hydrated ferrous sulfate. Which is the correct answer? The correct answer is option A. Hydrated aluminium silicate. Hydrated aluminium silicate is the kaolin or China clay. Now we are moving to the next question. Drug of choice in case of filariasis is. Drug of choice in filariasis is. Option A. Tinidazole. Option B. Piperazine. Option C. Metronidazole. Option D. Diethyl carbamazine citrate or diethyl carbamazine citrate. Drug of choice in filariasis is tinidazole, piperazine, metronidazole, diethyl carbamazine citrate. The correct answer is option D. Diethyl carbamazine citrate. Okay, drug of choice in filariasis. Now we are moving to the 19th question. Fractional distillation is employed. Fractional distillation is used for the preparation of. Fractional distillation is employed for the preparations of. Options are alcohol. Option B. Sorbitol. Option C. Benzene. Option D. Propylene glycol. Okay, what are the options? Alcohol, sorbitol, benzene, propylene glycol. In which of the following preparation fractional distillation is used? The correct answer for this question is option A. Alcohol. In case of alcohol preparation, we are using fractional distillation. Now we are moving to the last question of this video. Inert gas used in the propellant in aerosol formulation. Inert gas used as propellant in aerosol formulation is. Options are nitrogen. Option B. Helium. Option C. Both A and B, that is both nitrogen as well as helium. Option D. None of the above. Inert gas used as propellant. Inert gas used as propellant in aerosol formulation is. The correct answer is option A. Nitrogen is the correct answer. Nitrogen is used as a propellant in aerosol formulation. Okay, thank you very much for watching this video. Hope you understood all the questions. If you have any query, you can ask in the comment section. If you didn't subscribe until now my channel, kindly subscribe the channel and also press the bell button so that you will get the notification whenever I upload new videos. Thank you very much.